In this lecture, we're going to explore the counselor's role in diagnosis, emphasizing both ethical and practical considerations. Diagnosis is a multifaceted process connecting the counselor's insights, the client's experience, and the broader healthcare system. Today, we'll focus on defining diagnosis, ethical considerations grounded in the 2014 ACA Code of Ethics, practical aspects such as billing and client collaboration, and the importance of cultural and individual sensitivity. Alongside these topics, we'll examine the critical role of curiosity in shaping counselors' approach to diagnosis and care. So, we're going to start by defining diagnosis, but to get here, let's also think about its counterpart, assessment. Assessment helps us build a deeper understanding of our clients and the issues that they're facing. Think of tools like the Beck Anxiety Inventory or PTSD screening instruments. These help us gather information and paint a clearer picture. Diagnosis, on the other hand, is a specific term, a medical term really, and it might feel a little clinical at first, but it's a vital part of who we are and what we do as counselors. It's not about reducing people to labels, it's about creating a starting point. Diagnosis establishes a baseline. It tells us where we're beginning so that we can move forward with evidence-based treatments. It's also about working within the therapeutic relationship, leveraging that connection to help our clients grow. So let's unpack this idea a little bit more. Traditionally, diagnosis is defined as an identification of the disease-causing pathogens responsible for illness. That definition works really well for physical health, but in mental health, we know it's more complex. Mental health issues often arise from a combination of genetic factors, environmental influences, and more. Descriptive symptoms, things clients report or we observe, might include behaviors or questionnaire results. Then there are somatic symptoms, biological or chemical markers like sleep disturbances or hormonal changes, which might feel more tied to physical health. We also need to consider how we frame diagnoses. In the United States, the DSM-5 TR encourages a spectrum-based approach. It's not just you meet criteria or you don't. It's about degrees, mild, moderate, severe. And cultural and systemic differences remind us that diagnosis is not universal. It evolves with time, culture, and new knowledge. Even as we move away from a purely medical model towards a biopsychosocial perspective, diagnosis remains about identifying the root cause. It's not about finding a perfect answer on day one. It's about starting a process that's flexible and humanistic. Diagnosis is a tool, not an endpoint, and it grows as we grow with our clients. But once we've understood this purpose, what else do we have to consider? How does a client view their symptoms? If they're not struggling and you think they are, who takes precedence? And are you the expert in the room or are they? It's worth reflecting on whether the symptoms are truly pervasive for the client or whether they're content living as they are. Perhaps something is clearly a problem for both of you, but they're not ready to change. Then what? So why do we diagnose? What does it mean to put a label on someone's experience? These are big questions in the counseling profession, and honestly, there's no single answer. If insurance didn't require it, would we still diagnose? Some clinicians would argue no, and that debate has been ongoing for decades, but there are some undeniable reasons why diagnosis has a place in our work. First and foremost, let's talk about insurance. Like it or not, insurance companies require a diagnosis for reimbursement, and that's the practical reality. Without it, clients might not be able to access the therapy or medications that they need. Now, does that mean that we slap on a diagnosis after one quick session? Absolutely not. A diagnosis should be a thoughtful, evolving process. Sometimes you might start with a working diagnosis that changes as you get to know the client better. And yes, insurance companies understand that too. Diagnoses can and should evolve over time, reflecting the therapeutic process. Beyond billing, diagnoses can provide access to vital services and protections under legal guidelines. For example, individuals with intellectual disabilities like autism often qualify for programs and accommodations they wouldn't have without diagnosis. On a broader scale, diagnosis helps create a kind of census for government planning. They inform policies, funding, and preparedness for public health issues, like the growing need for substance use treatment. Diagnoses also streamline communication among professionals. When I'm collaborating with a psychiatrist, an occupational therapist, or another counselor, having a shared diagnostic language ensures that we are all on the same page. It's like shorthand that helps us quickly understand what's going on and what's needed. And let's not forget about the impact on families and clients themselves. For many, getting a diagnosis can bring a sense of relief. It's an explanation, a validation, and a starting point for finding resources and solutions. Think of the families who struggle to understand their child's challenges. A diagnosis can help them move forward with a clearer path and less fear of the unknown. Finally, and perhaps most importantly, diagnosis informs treatment. As one researcher put it, a diagnosis is only as good as the treatment it leads to. If a diagnosis doesn't guide us towards effective interventions, then it's not doing its job. Sure, some diagnoses are purely descriptive and might not offer much insight into treatment. Autism is one example where interventions need to be tailored to the individual. But in most cases, a good diagnosis helps us figure out what kind of support, therapy, or interventions will actually make a difference. Diagnosing clients requires balancing thoroughness with practical constraints. Initial assessments should gather comprehensive information through interviews, assessments, and observations. Collaboration is key. Engaging clients in understanding their diagnosis ensures they feel empowered rather than labeled. Supervision and consultation provide critical support for complex cases, allowing counselors to navigate uncertainty ethically. Remember, you are not on an island. If you are not sure, seek help. Documentation is another vital aspect of diagnosis. Records must be clear and accurate, providing a foundation for treatment and reflecting any changes as the therapeutic relationship evolves. Flexibility is crucial as clients' diagnoses may shift over time in response to new information or therapeutic progress. Culture shapes how clients experience and express symptoms. Diagnoses must be contextualized with each client's cultural framework to avoid bias. For example, what might appear as anxiety in one cultural context could be understood differently in another. Counselors should explore how systemic oppression and environmental factors contribute to client experiences and symptoms. Understanding clients' cultural backgrounds and personal narratives requires curiosity. Asking thoughtful questions, being open to learning, and remaining attuned to the client's worldview are essential for accurate and compassionate diagnosis. Counselors play a pivotal role in the diagnostic process, but this goes beyond simply identifying symptoms and assigning a label. To fulfill this role effectively, counselors must first cultivate self-awareness. Every counselor brings their own experiences, feelings, and biases into the therapeutic space. Recognizing how these factors influence your work is essential. Supervision offers a structured way to explore these dynamics, providing insight and support. Similarly, personal counseling can help counselors process any emotions or reactions that arise from their work. This is not a sign of weakness, but a reflection of the deeply human nature of the counseling profession. Being human means being impacted by the work that you do. It's natural and it's expected to feel deeply about the clients that you serve. However, awareness and self-reflection are necessary to ensure that these emotions enhance rather than hinder the therapeutic process. By staying present with your own thoughts and feelings, you can better navigate the complex relationships and challenges inherent in the work. Ethically, counselors have an obligation to their clients and the broader community. The ACA Code of Ethics serves as a foundation for navigating this responsibility. While it may seem dry or self-evident, the Ethics Code establishes boundaries and protections that uphold the integrity of the profession. It's also a reminder to continually stay informed and adaptable. As the DSM evolves, as seen with changes from the DSM-4 TR to the DSM-5 and now the 5 TR, so too must counselors evolve. Whether it's new diagnostic criteria or emerging research, staying current ensures the best possible outcomes for clients. The role of the counselor also extends to fostering collaboration and empowerment. From first contact, be it a phone call, email, or intake session, counselors have the opportunity to build a therapeutic alliance. This relationship is a cornerstone of effective treatment. For many clients, particularly those with high ACEs scores or trauma histories, feeling heard and involved in their care can be transformative. By engaging clients as collaborators in their treatment, counselors help them reclaim agency and build self-awareness. Ultimately, the counselor's role is both practical and relational. It's about staying informed, remaining self-aware, and prioritizing the client's growth and empowerment. This balance requires effort, but it's what makes the work meaningful and impactful. Diagnosis is not a passive process. It's an intentional, collaborative journey we take with our clients. It starts with listening to their stories, observing their behaviors, and recognizing both descriptive and somatic symptoms. It's about exploring not just what a client tells us, but also what their nonverbal communication reveals. How does their past influence their present? What connections can we draw between their history and their current experiences? This process often begins before the first session and evolves over time. It's not about being perfect, but it's about being thorough, curious, and adaptable. Confidence in diagnosis grows with competence, and as counselors, we must embrace the fluidity of this work. Clients change, life happens. A diagnosis that begins as depression or anxiety might shift as trauma emerges or as life circumstances evolve. The DSM's continuum approach reminds us that clients aren't static. They exist on a spectrum of experiences and resilience. And it's also important to understand what feels like for our clients to receive a diagnosis. For some, it's a relief, a name for their struggle and a sense of belonging. For others, it might feel limiting or even incorrect. Still, others might wrestle with denial, grief, or even anger. These reactions are valid, and it's our role to hold space for them. Communicating a diagnosis with empathy, clarity, and openness ensures clients feel seen and supported rather than labeled or dismissed. It's a conversation, not a decree. And yes, mistakes can happen. No diagnostician is infallible. What's important is to remain open to feedback, to lean into supervision when uncertain, and to continuously refine our understanding of each client. Progress, not perfection, is the goal. Diagnosis is a living process shaped by the relationship we build with our clients and the insights that we gather along the way. Diagnosis is an art and a science, a process that evolves as we deepen our understanding of the people that we serve. It's not just about assigning a label, but about fostering connection, collaboration, and clarity. It's a tool for understanding, a map for treatment, and sometimes a lifeline for clients seeking validation and hope. As counselors, we juggle the complexities of ethical standards, practical constraints, and cultural nuances. We navigate our own biases, lean into discomfort, and embrace the ever-changing landscape of the human experience. It's a lot, but it's also what makes this work deeply meaningful. So as you move forward in your practice, remember that diagnosis is not about being perfect. It's about being present. It's about listening, learning, and growing, both with and for your clients. And above all, it's about approaching each person with the curiosity and care that define this profession at its best. So let's keep asking questions, stay open to the answers, and never stop growing. And on this slide is some resources if you're interested in reading more about what I talked about today. I highly recommend reading through the American Counseling Association Code of Ethics. It was published in 2014, so it is due for an update, but this gives us a really good baseline of what we're looking for regarding diagnosis and the treatment of clients. If you have any questions, please reach out to me.